and people can actually access treatments.
Thank you, Mr Dowd, and it's a pleasure to serve under your chairship. And I want to start by thanking the Honourable Member for Stretford and Urmston for securing this debate and for speaking so powerfully on how the dentistry access crisis is affecting cancer patients and survivors like his constituent Michelle. I had the pleasure of meeting Michelle along with the Honourable Member earlier today, and it was really eye-opening to hear the stories of what cancer patients and survivors face. And I'm delighted she is here today, and I want to thank her for all of her campaigning and the support she is providing now to people suffering pretty much what she had to go through. I'm afraid to say, though, that we are seeing the Dickensian state of NHS dentistry under this government. Most of us might think that our teeth would be the least of our worries if we were diagnosed with cancer, but as we've heard today, oral health is incredibly important. And whilst undergoing treatment, many cancer patients who previously had little or no dental issues can actually experience loss or crumbling of teeth together with a whole host of other dental problems that occur during or after treatment for cancer. Poor dental hygiene can lead to infections which can interfere with a patient's chemotherapy. Radiotherapy can cause acute complications to your teeth and gums from tissue damage. And in rare cases, extractions afterwards can result in bone necrosis where the jawbone essentially dies. So it is crucial that timely access to dentistry, including any required treatment and preventative advice, is provided before, during and after cancer therapy to maximise positive outcomes. The last thing any cancer patient needs is to find that they can't access a dentist when they need one. But as the Minister is aware, the current crisis in access to dentistry is shocking. After over a decade of neglect, patients are desperately queuing around the block to see a dentist. 8 in 10 practices aren't taking on new adult NHS patients. And as we've heard today, 1 in 10 people have tried DIY dentistry. It is some of the most vulnerable people in society who need to get seen that are actually missing out. And I want to share with the Minister some of the stories that have been shared with me ahead of this debate. Michaela from Alsford said, "I lost all my root canals and my teeth just started falling to bits on chemotherapy. I wasn't able to see an NHS dentist and I couldn't afford private. I'm awaiting treatment again for cancer for the second time and urgently need my teeth sorted before I have chemotherapy again, but I can't get in to see a dentist." And Carol from Shropshire said, "I was with an NHS dentist but missed a checkup while going through chemo as I was very ill, so I got knocked off. I had problems when taking ibudronic, tablets for bones, had to go for emergency treatment, and the NHS dentist in Shrewsbury is 17 miles from my home. This was 2 years ago. I've still not been able to register. I've tried surrounding towns. I know I'm not on my own. There are hundreds in the same situation as me." What does the Minister have to say to both Carol and Michaela? Can she say if her department has made any estimate of the impact that the access crisis is having on cancer patients and survivors? And as we heard today, according to research by Macmillan Cancer Support, 4 in 5 cancer patients are hit with an average cost of £570 a month as a result of their illness. If patients face oral health complications because of their treatment and they can't be seen on the NHS, most will simply go without. This idea that we have a two-tier system where those that can afford to go private and the rest go without is absolutely obscene. So how is the government working to minimise the financial cost of cancer on patients and survivors, which can itself knock back their health? It was disappointing to hear from Michelle how when she was diagnosed with breast cancer, she wasn't actually told about the impact her treatment could have on her oral health by her doctor. Surely, I know the Minister will accept this advice should be routine, and the DHS guidance for delivering better oral health actually says that cancer patients should receive appropriate care to manage and stabilise their oral health in advance of treatment, but it appears that not all cancer patients are getting this support. So I urge the Minister to please try and address this and raise this where possible. And in my own team, one of my staffers' parents was diagnosed with throat cancer in 2020, but didn't get his orthodontist appointment to have 4 teeth removed until a year after his treatment. So can the Minister comment on the fact that the latest estimates show that in February 2024, there were over 325,000 patients waiting for oral surgery in England. That's nearly 200,000 since 2015, almost a decade ago, which was the last time that the NHS target was actually met. So how many cancer patients are seeing their treatments delayed as a result? There is also the dire issue of cancer diagnosis themselves. Oral cancer is now one of the fastest growing types of cancer in the United Kingdom, with mortality rates up 46% on a decade ago. So it now kills over 3,000 people a year in the United Kingdom. But if diagnosed early, oral cancers have a survival rate of roughly 90% compared to 50% if diagnosis is delayed. As dentists are often the first to spot the early signs of this disease, can the Minister say if she has made any assessment of the contribution the dentistry crisis is having on these appalling mortality figures? In the Commons, as has been said by my honourable friend for Bolton East, in the Commons in February, the Health Secretary claimed, I quote, "There is 200 million on top of the 3 billion that we already spend on NHS dentistry in England." But that is not true, notwithstanding that 1 billion of this is actually covered by patient charges, not central government. She also subsequently admitted this will come from existing budgets. So really, this is only 200 million as part of the money she might spend on NHS dentistry if the 400 million yearly underspend persists. Mr Dowd, the Health Secretary, also claimed, I quote, "The opposition's ambitions reach only as far as 700,000 more appointments, and our plan will provide more than 3 times that number of appointments across the country. That is 2.5 million. But that's not true either, is it? It's not true because the government scheme will only run for 1 year, and Labour's plan would deliver both in the here and now and into the future. Perhaps the Health Secretary might correct the record on that too. Mr Dowd, my honourable friend, the member for Stretford and Urmston, shared how joining up services in hospital for cancer patients could actually address access to dentistry for those very high-risk patients. NHS dentistry is dying a slow death under this government, and the people who rely on NHS care cannot wait another 5 years for a Tory government to decide that this time they really mean it and they will reform the NHS dentistry for good. Labour's fully funded plans would provide 700,000 more urgent appointments a year, supervised toothbrushing schemes in areas of deprivation, and a targeted recruitment scheme in left-behind areas, all paid for by cracking down on tax dodgers. And we would get on with reform to the NHS dental contract that this government has put off for 14 years. Cancer patients, new mothers, rural communities, and millions of others are being failed every year that we let the decay in NHS dentistry continue. Thank you.
Minister.